All right, welcome everybody. We're going to go ahead and get started. So good morning, good afternoon, wherever you're tuning in from, and welcome to our May webinar series brought to you by CPS HR Consulting, your partner for HR in the public sector. In today's webinar, we'll be diving into Fostering Mental Health, HR's Perspective, presented by CPS HR Senior Consultant, Megan Masasi-Randles. Before we kickstart this session, I just have some quick housekeeping notes. Sorry, one moment. This webinar is being recorded and will be accessible for replay. We will post the recording on YouTube and on the CPS HR webinar webpage for your convenience. All attendees will be in listen-only mode to ensure the best audio quality for everybody. So please feel free to use the chat feature to engage in conversation and share your thoughts with one another. If a question pops up during the webinar, don't shy away. Use the Q&A feature to send it in, and we'll tackle as many as we can towards the end, time permitting. Now, without further delay, I'm going to hand it over to Megan to enlighten us on fostering mental health. Take it away, Megan.
Thank you, Marissa. I'm going to put on my reader so I can see. I felt a lot of pressure today to look like my profile picture. So, that's how it is in the remote landscape. So thank you for joining us today for this presentation on fostering mental health in the workplace. We are going to talk about mental health issues and the impacts that those show up in our day-to-day work lives. We are going to touch on some legal considerations that we as HR professionals need to consider when handling mental health issues and impacts in the workplace. And we're going to spend the majority of the time talking about creating a supportive workplace culture. We'll look at how to implement and improve our existing policies and procedures, and how to gather some metrics that we might already have in supporting a business case for mental health initiatives in your organization. And finally, we'll touch on what are some of the best practices for how we can demonstrate the effectiveness and impact of our efforts. So, who are we? My name is Megan Masasi-Randles. As Marissa said, I am a senior HR consultant at CPS HR. I've been with the organization for about 3 years. Prior to joining CPS HR, I spent about 22 years in the public sector in all different areas and facets. So I've worked at individual towns and cities. I have worked at the county level. I have dabbled a lot of years in education, working in K-12, County Office of Education, as well as community colleges. And most recently, before coming to CPS, I was the HR manager at the University of California's California Animal Health and Food Safety Laboratory. My co-creator of this presentation is not able to join us today, but I want to do her proud. So I'm going to give you her introduction so you understand where the information is coming from. Jacqueline Padilla is the CHRO at CPS HR. She's been with our organization for a little over a year. But prior to coming to CPS HR, Jacqueline spent 22 years at the state of California in various roles, to include the Deputy Director of Human Resources for the Department of Corrections, as well as covered California. During her career, she had various other leadership titles in the human resources landscape throughout the state of California. So our caveat for this presentation for legal is that neither of us are healthcare providers. Instead, we come to you with a combined 40 years of human resources experience. So our perspectives are from an organizational HR vantage point and not a clinical perspective. So with that, let's get started. Marissa is going to queue up a quick poll. And while you guys are responding to that poll, I just want to again welcome you to today's presentation on fostering mental health. Mental health is a crucial for overall well-being. And as HR professionals, it is our responsibility to create a supportive work environment for our employees. So if you go ahead and answer those polls, we'll just give it another minute. Okay. So that just gives us a little bit of perspective of where you are with the landscape of mental health. And we are going to first look at the definition of mental health in the workplace, which refers to the psychological and emotional well-being of our employees. It encompasses, excuse me, it encompasses factors such as stress management, coping mechanisms, work-life balance, and interpersonal relationships. Mental health is not just the absence of mental illness, but it is also the presence of positive attributes such as resilience, emotional intelligence, and psychological flexibility. So why is mental health important for HR to address? Our why is simple, because what is good for the employee will be good for the organization. When organizations prioritize mental health, it fosters a supportive and inclusive workplace culture. This allows employees to feel valued, respected, and cared for, thus improving not only the employee well-being, but also their productivity and performance. There has been tons of research that shows a direct correlation to an employee's mental health and their job performance. Supporting mental health and employee well-being increases productivity and performance for our employees. We as HR professionals also have a duty of care to ensure the health and safety of our employees. This includes mental health and providing appropriate support. That this is not only our legal obligation, but an ethical one as well. And we will review some laws that support this concept. If we're doing the first three, then these are likely going to drive up our organizational reputation. Organizations that demonstrate a commitment to employee well-being and mental health are just more attractive to top talent and enjoy a positive reputation among their stakeholders. This is a double bonus because our employees are our best or worst recruiters. If they love the organization, feel valued, then that is going to spread amongst their individual networks and help us to become an employer of choice. And as if you needed another reason, all of this is going to generate cost savings. Let's put that in our back pocket for when we need to build our business case. Because investing in mental health initiatives can result in cost savings associated with absenteeism, turnover, and healthcare expenses. So, are we ready? Let's look at some statistics that I found on mental health in the workplace. Mental health conditions in the workplace are a growing concern. According to the World Health Organization, depression and anxiety disorders cost the global economy an estimated $1 trillion per year in lost productivity. The American Psychological Association reports that nearly half of all employees have experienced symptoms of depression at work, and around 2/3 have experienced significant chronic stress. A study by the Center for Workplace Mental Health found that mental health conditions are among the leading cause of disability worldwide and are responsible for more than 30% of all disability claims in the United States alone. These are staggering and shocking statistics. It is clear that mental health in the workplace is not just a personal issue. It's a significant concern for businesses and economies worldwide. So what exactly do we mean when we talk about mental health? Let's delve into a comprehensive definition to better understand what mental health can show up as and the implications that have individuals and organizations alike. Okay, so probably some of the most common mental health conditions that you might be aware of, either in an HR capacity or just in your capacity as a human, is probably depression and anxiety. But let's define and gain some perspective of what it's like to live with both of these conditions. Depression is like having a rain cloud follow you around, making everything seem gloomy. It can zap your energy and enthusiasm for things you used to enjoy. Anxiety is a completely different beast. It's like the mind hits a panic button for no apparent reason. You're worrying about things that haven't even happened. Your heart is racing like you're doing a marathon. You might lose your vision might narrow to a tunnel vision, and your hearing might sound like you're underwater. The effects of anxiety can be debilitating. Imagine being in a crowded room, suddenly feeling like you can't breathe. Your heart is pounding out of your chest. You can't hear anything, and your vision has narrowed to just black dots. That's what it can feel like to have a panic attack. Obviously, that would be debilitating. Another condition that shows up often in the workplace is stress-related disorders, starting with chronic stress. This is not everyday stress. This is a long-lasting, days, months on end, that leaves you feeling constantly like you're running on empty. It's like your body and mind are in a constant state of emergency, which can take a toll on not only your mental, but also your physical health. It can impact the physical health, such as showing up as chronic migraines, headaches, vision and hearing changes. It can be tense in your body, inability to concentrate or even know how to start your day. These are all signs that your mind might need a little TLC too. So it's simple. Understanding and addressing these mental health challenges is key to living a happier and healthier life. By recognizing these common struggles and seeking support when needed, we can take steps towards feeling more balanced and fulfilled. So understanding how mental health can show up on the impact on employees and the organizations can look like decreased productivity, increased absenteeism, and higher turnover rates. It's crucial for HR professionals to understand these impacts and develop effective strategies to support employees and foster a positive work environment. When we're looking at decreased productivity, we find employees struggling with mental health conditions may find it challenging to concentrate, make decisions, or complete tasks efficiently and effectively. Mental health conditions can lead to more frequent absences from work due to illness or treatment. And additionally, if there is a stigma in our organizations that does not support employees' whole health, especially in our policies pertaining to leave usage, then our employees are more likely to come to work even though they don't feel well, resulting in presenteeism, where they are physically present but not fully productive. Then the inevitable comes. Employees experiencing mental health conditions who feel unsupported, judged, or overwhelmed by their peers or supervisors often have dissatisfaction with their jobs, which leads us to increased turnover. Understanding the prevalence and impact of mental health conditions in the workplace is crucial for HR professionals to develop effective strategies for supporting employees and fostering a positive work environment. So let's look at that legal landscape related to mental health in the workplace. These protections aim to protect employees' mental health and well-being in the workplace. I'm sure you're familiar with these. The ADA prohibits discrimination against individuals with disabilities, which includes mental health conditions in all areas of public life, which also includes employment. Employers are required to provide reasonable accommodation to qualified employees with disabilities, which may include adjustments related to mental health conditions, such as modified work schedules or job accommodations. Family Medical Leave Act, or FMLA, provides eligible employees with up to 12 weeks of unpaid job-protected leave for specified family and medical reasons, including mental health conditions. Employers covered by FMLA must grant leave for eligible employees who require time off for their own serious health condition or to care for an eligible family member with a serious health condition. And finally, Occupational Safety and Health Administration, or OSHA, guidelines require employers to provide a safe and healthy work environment for all employees, which includes addressing workplace factors that may contribute to stress or mental health conditions. Employers should identify and mitigate workplace hazards that could impact an employee's psychological well-being, such as excessive workload, harassment, or bullying. So building upon our legal obligation, there are also ethical obligations that come from our duty of care to ensure the well-being of our employees. This is including their mental health. We need to ensure that as employers, we provide an environment that protects the health, safety, and well-being of our employees while they are at work. This duty extends to their mental health as well as their physical health. As HR professionals, we play a critical role in creating a safe work environment. This can be seen in the development and implementation of policies, procedures, and programs that support employee mental health and create a psychologically safe work environment. And failure to address mental health issues in the workplace not only exposes employees to potential harm, but it also puts employers at risk of legal liability for discrimination, harassment, or failure to provide reasonable accommodations. Let me give you an example. If an employee is treated unfairly or subjected to negative treatment because of their mental health condition, it could constitute discrimination under laws such as the Americans with Disabilities Act or the Equal Employment Opportunity Commission. Legal fees, settlements, and damages would be significant, not to mention the damage to the organization's reputation. The ADA and the EEOC play crucial roles in protecting the rights of individuals with mental health conditions in the workplace and ensuring that employers fulfill their legal and ethical obligations to provide reasonable accommodation and prevent discrimination. Compliance with these laws is essential for creating an inclusive and supportive work environment for all employees. So building upon not only our legal and ethical obligations, HR professionals must also adhere to strict confidentiality and privacy standards when handling employee mental health information or any medical information of their employees. We need to ensure that this sensitive information is only shared on a need-to-know basis and in compliance with relevant laws and regulations. We also need to ensure our policies that's collecting, retention, storing, and accessing employee medical information is compliant with privacy laws. Think of HIPAA and GINA, the Health Insurance Portability and Accountability Act, or the Genetic Information Non-Discrimination Act. Navigating the complex legal and ethical landscape surrounding mental health in the workplace requires HR professionals to stay informed about relevant laws and regulations, uphold their duty of care to their employees, and prioritize confidentiality and privacy in all aspects of managing an employee's medical information. This includes requests for leaves and accommodations. Okay, so before I get into the content on this screen, I'd like to do a quick exercise to make sure y'all are still with me. So I invite you in the chat to type your mental health mantra. This could be a brief mantra, positive affirmation that you use to support your own mental health. And to get your creative juices flowing, I'll give you an example. My family is a huge Disney fanatic family. And so the one that always comes to mind for me when I am feeling overwhelmed or just going through it, whatever that might be, is I always picture Dory from Finding Nemo and remind myself to just keep swimming. Oh. So I would like to see you, your positive affirmations or quotes that help you. And my goal here is to flood this chat box with all of the positivity. So don't be shy, keep those coming. And I'm hoping that maybe one or two of us in this call will see something in there that resonates with us, and we can incorporate that into our own toolbox to use when we need it. Okay, they're looking good, but keep them coming. So while y'all are entering those, I'm going to start with, how do we break the stigma and foster a community of support in our workplace? My perspective is this comes down to three key areas: training, access, and communication. Training. We need to offer regular sessions that promote our benefits and support programs that we have in place at our organization. We need to make sure employees understand what aspects of care are covered under these different plans. And we need to make sure make sure our employees know how to access these benefits and coverages when they need support. This is going to move a really common barrier to usage, is that if employees have to reach out and ask their supervisor or HR how to access the EAP program, how to access mental health services under their benefit plan, a lot of employees will not access those programs or parts of their medical coverage for fear of being judged by the person they're asking for access. So we need to make sure that we make these programs accessible and that we're constantly promoting them so that this just removes that barrier to usage. We can also bring in professionals who provide counseling services, or we can do presentations on coping strategies. These could be stress management. These could be time management courses. These could all be parts of your wellness initiatives that give employees the tools to identify their stressors and then also provide coping mechanisms. And these can be on-site presentations, or they can be in a virtual capacity. And if you look and contact your brokers or your insurance companies, a lot of facets of these plans that we give our employees or offer our employees have educational departments that will do this at little to no cost. And finally, effective communication. We need to know and empower our supervisors on how to recognize the impacts of the mental health conditions we just talked about, and how to engage in supportive communication with their employees when you identify these impacts in an employee's performance. And then lastly, we need, sorry, I forgot to move the screen forward. So bear with me. So here we go. So what are some resources that can be provided to employees to support their mental health? The one at the top of this slide is probably the one that comes to the top of your mind, which is employee assistance programs. Generally, these offer confidential counseling services, crisis intervention, and referrals to mental health professionals through an EAP provider network that is separate from your medical insurance. Generally, these plans will cover not only the employee, but also eligible family members. So we need to ensure employees are aware of how to access these services and that they feel comfortable using them. And this goes beyond just mentioning it at their new hire orientation or once a year at open enrollment. This really needs to be an intentional and scheduled promotion of these programs so that when someone needs it, they know where to find it. Like we said on the previous one, sometimes you may bring in presentations that focus on reducing stress, work-life balance, stress management, healthy eating, the importance of, addressing back pain or ergonomic issues. You could have these presentations coordinate with a national campaign, such as May's Mental Health Awareness Month, or you could just implore a day of health in your organization. It can be part of your open enrollment fair, or it could just be a quarterly presentation as part of your wellness initiative that rotates on your mental health, emotional health, financial well-being, and communication strategies. And lastly, flexible work arrangements. If I think back to the most positive thing that came out of 2020, I think the silver lining that came from the pandemic was that it forced us, especially those in the public sector, to quickly adapt and change how we've always done things. Usually those things are not used in the same sentence. As I think we're now settling back into our post-pandemic world, we need to hold on to the flexibility and adaptability that the pandemic forced us to have. We can create policies and guides for supervisors to support them in analyzing work hours, what remote work options may be applicable, and job accommodations to help employees manage their mental health while still meeting their job responsibilities. HR can take a role in providing this by having clearly defined parameters and assisting supervisors in shifting how to supervise employees in a remote or hybrid situation, and ensuring equitable considerations when evaluating requests. Okay. So part of creating a supportive work environment means there is a promotion of work-life balance. Supervisors and managers pay, I think supervisors and managers sometimes struggle with taking vacation or not working during their vacations. But I really implore you that this is one of those initiatives that we need to have our supervisors and managers model what we want our employees to do. If you want to encourage them to use their accrued leaves, take a mental health day, they need to have permission and see supervisors and managers also doing those things. As managers and supervisors, we can look at what our employees' accruals are and when's the last time they took some time off. And you can have that as a standing agenda item in your one-on-one meeting. That's helping to create an openness to be like, hey, your accruals are high, you're almost at the cap. What's your strategy to take some time off? And then that can open feedback for if they're feeling overwhelmed. Well, I don't want to take time off because it's just going to all be sitting there and waiting for me when I come back. And that can open a dialogue and conversation and have a supervisor honestly reflect on where is the redundancies in their organization. Do they have team members cross-trained so that people can benefit from taking their time off and not come back and feel like I'm feeling punished for taking that time off because everything just sat here and waited for me. CPS HR, what we did was our senior leadership noticed about 10 years ago that there were people not taking time off. And so they really thought hard, looked at the numbers, and decided that they were going to institute a holiday closure. So at CPS HR, for example, we are closed. It's a mandatory closure from Christmas Eve to New Year's Day. This is built into our client deliverable contracts. And it really came about because we were looking at the leave usage and finding that people weren't utilizing it, and instead were just cashing out their vacation time. I think at first there might have been resistance towards this forced holiday closure, but year after year in our employee engagement feedbacks, this is the benefit, and I call it and truly see it as a benefit that our employees are so grateful for, because everybody from the CEO to the office assistant to the telephone operator take that period of time off to rest and recharge. Another way to promote work-life balance is to look at what flexible scheduling do you have within your organization. Again, can you offer compressed work weeks? Is there job sharing arrangements that might be beneficial to employees? Can you have, do you have, again, like we talked about, redundancy in your cross-training duties so that when someone takes time off, they're truly not bothered, and that they also are not overwhelmed when they return from that glorious vacation? And are there remote work options that can reduce commuting stress and promote work-life integration? This can be accomplished by analyzing the jobs and determining a needs assessment of looking at what needs to be done on site and where you have some hybrid option or flexibility. Wellness initiatives. I really think this is my favorite aspect of promoting and fostering an employee mental health and supportive culture, because I think these things can really shift your entire culture and morale of an organization. It can impact employee engagement and job satisfaction, and it can build a sense of connection and belonging amongst your personnel. You can implement a wellness program that focuses on physical, mental, financial, and emotional well-being. Offer resources, activities, on-site or virtual, that really help employees manage stress and prioritize self-care. Think about meditation sessions, mindfulness training, time management, stress management. If you can't offer these services on site, are you promoting them through your engagement activities and through your collective workday? When you're having meetings, are you incorporating stretching and movement breaks? Can you lessen that hour-long meeting to 45 minutes to allow for a break between meetings? Do you have a regular cadence of motivational Monday quotes, for example, to engage and encourage some community building and support within your organization? I know we're here to do work, but are you incorporating fun? Let me give you an example of fun. About 3 years ago, we reviewed our employee engagement feedback and comments, and we saw a lot of frustration with our employees who were saying they couldn't take their 15-minute breaks. They weren't taking their lunches because they were just overwhelmed with work. So we did a really big campaign where we pushed, please schedule your 15-minute breaks, schedule your lunches on your calendar. When you do this, you get that reminder from your Outlook calendar, number one, to remind you to go do something in 15 minutes. But it also is less likely that other people will schedule meetings over this blocked time. And the chances are people will be more likely to actually take those 15-minute brain breaks, their lunches, and then come back more refreshed and energized to tackle the next meeting or deadline. So after about 6 months of reminding people, we were still hearing the same feedback. Oh, I just can't take these 15-minute breaks. So we did a quick research about the benefits of a 15-minute brain break and what that does to your body, your mental, emotional, and well-being. And we put it in a calendar blurb. I think it's one of the resources Marissa's going to share with you. And we made it fun. And we challenge people to come join us for 15 minutes of fun. That's what we call it. And it's a virtual trivia. The trivia can be centered around anything you want it to be. For us, we started out with seasons or holidays within the month. We've also done pop culture trivia, music trivia. We have done sports trivia, anything you want. This is a virtually free event. I think it costs us about $49 for a subscription to a trivia platform. And when we first started this 3 years ago, I'm not going to lie, there were 3 participants on the call, and we might have all been the organizers, but that's okay. Because it's kind of like the movie Field of Dreams. If you build it, they will come. And so we kept at it. We kept pushing out invites to our 15 minutes of fun. And 3 years later, I will say we have seen 30 to 40 members of our team constantly join and, join our 10 to 15 minute virtual trivia game. And it's so important. We are an 85%, 90% fully remote environment. So this allows for us to get to chat, talk with, kind of have that water cooler moment in a virtual environment and have some fun, and then head back and tackle that next meeting. So diving deeper into wellness initiatives, because you can tell that's my passion. These can be large scale programs. Think about the organizations that have on-site gyms or fitness centers. It could be nutritional education. Have you implemented a healthy foods policy? It can be offering those presentations and trainings on stress management workshops. And again, you can get those many times through your brokers or your health insurance carriers for no cost. Just they have an education department, and they're willing to come to you and give your employees a presentation that can really arm them with the tools to identify their stressors and develop healthy coping habits. You can, again, start this as a grassroots effort where you promote a week-long or month-long step challenge, a water challenge, canned food drive, really with little to no cost, or you can get buy-in. We're going to talk about some metrics in a moment, from your organization, and get some financial support behind your wellness initiatives. The biggest thing is to really just start this. Okay, so development of mental health policies. This really means that we need to look at our employee handbooks, our policies and programs surrounding leave requests, our usage guidelines for our accruals. And we need to make sure that we're reviewing those on a regular cadence to make sure they're in compliance with the ever-changing landscape of legal and court decisions that may impact some of those laws we spoke about earlier. And we also need to make sure that they're just foster inclusivity. And so that, in order to also make sure our policies are legal and in compliance, we also need to train. We need to train not only our HR staff, but our supervisors and managers, because they're our front lines and they're working closely with our employees in recognizing the signs of mental distress. And we need to give them the training to have effective communication around those difficult conversations. Sorry about that. Oh, Marissa, I got all messed up. Okay. So sorry. So recognizing the signs of mental distress, we need to make sure that supervisors and managers know how to recognize how these mental health conditions can show up in the workplace. That can be changes in mood, behavior, and performance. And we need to equip them on how to have these conversations and approach employees from an area of support, compassion, and non-judgmental manner. HR is going to be your biggest strength here. Effective communication, that's our wheelhouse. So HR offer to facilitate those trainings on how to have difficult conversations, how to handle conflict resolution, what are different communication types, and how do we adjust our communication styles so that it's well received by our employees. Just start. So how do we implement mental health procedures and update existing policies? We really need to review them, and we need to review them for our inclusive language. We also need to look at what metrics we already have. So are you doing annual employee engagement surveys? Are you doing new hire onboarding surveys, 6-month check-in surveys? Are you doing exit surveys? Using these surveys and platforms for employees to give you feedback relevant to stressors in their job, stressors in their life, can give you opportunities to address those and bring in supports that are relevant to your population. And of course, we need to make sure that we stay up on the ever-changing legal landscape. HR professionals, I implore you to sign up with some good attorney law firms and get on their mailing list to read those updates on Supreme Court decisions and bills that are currently in the process of being approved, so that you are proactive instead of reactive in maintaining your agency's policies and compliance. Okay, so I hope I haven't made you dizzy so far with my poor control of the slides, but metrics, we really need to think about how to take information we already have or can get reasonably and use that to build our business case for leadership to buy into mental health initiatives. Let's do another quick poll, Marissa. And while you are doing that, we're going to talk about looking at our employee engagement surveys that we already have. The surveys we talked about on the previous slide. Absentee rates. Sometimes this can be difficult to track, but sometimes your supervisors know who's calling in for a mental health day. Some organizations are starting to break apart their sick leave and their vacation day and actually have mental health days. That would be a metric. What is the utilization rate for those mental health days? That could be used here to serve as a metric for your impacts and success of before you had your program and where you are today. And then lastly, we can look at those turnover rates. Are we doing exit interviews? Do we know why employees are really leaving an organization? And we can use that information along with other information that we should have at our disposal. So we can look at aggregated data from our insurance carriers, from our EAP providers that tell us usage reports. They tell us percentages of people using it. Our insurance carriers can tell us what is the most money of our claims going towards. Is that going towards diabetes management? Is that going towards mental health services? They're not going to disclose private individual information, but they can give us aggregated data that can serve as our metrics. And we can use that aggregated data against benchmarks. Those can be benchmarks in your communities. You could be looking at county public health records for your area. You can be looking at national statistics that impact your industry of your organization makeup. And then not everyone is here, and that's okay. I'm going to say most employees are not, or most organizations are not going to be here, but you can have testimonials. I think mental health, helping reduce the stigma of mental health means talking about it and normalizing it. And it's okay if your organization is not here, where your employees don't feel comfortable talking about their struggles and how they've overcome it. That's okay. This is again where you can utilize those professionals from your presentations to talk about identification and strategies. And all of this will allow us to focus on the high-level success metrics that outline our future goals and commitments related to mental health. We can report out on this information at all staff meetings and even poll our employees to get information on where they're feeling the most stress. And that can lead to really helping them and having them help design the resources that you bring into your organization. Okay, we're wrapping up. We have Marissa, another poll, please, just to make sure y'all are still with me. While you answer that poll, I'm just going to outline some of the best practices we discussed today. So we talked about training employees and managers on mental health awareness and the impacts of those conditions in the workplace and how to identify those. We talked about best practices for implementing and promoting your EAP and your other benefit resources that you offer your employees, and highlighting the confidentiality, the accessibility, and the comprehensive support that these programs and plans offer. We can share best practices for offering flexible work arrangements to support employee well-being. That can come in the form of our policies and guidelines for equitable implementation and review. We can give training in our communication strategies of how to have these sensitive discussions. Okay, and a lot of you say leadership and culture, and you're right. We need to make sure that in addition to our wellness initiatives, that we have buy-in from our leadership and culture, and our managers are utilizing those services as well, and maybe talking about those to their employees. Hey, did you know I really used EAP and it was just great. It really helped me. Normalizing those kinds of conversations really give someone who might be struggling to ask for help permission to seek the supports that you have in place. By implementing these best practices, we can better support our employees and create a work environment that is healthier. So, thank you for taking the first step in prioritizing mental health in the workplace by attending this webinar. I'm so sorry. I am not great at controlling the slides. Prioritizing mental health in the workplace will have a positive impact on your employee engagement, productivity, and overall organizational success. There are moral, ethical, and business reasons for organizations to invest in mental health initiatives and create a supportive culture for employees. So where do you go from here? Take a screenshot. Here's your action plan, HR professionals. We need to advocate for the policies, programs, and supports that foster a culture of empathy and support and are inclusive to all of our employees. And we can use our metrics or find some metrics in our organization to support this, to create that leadership buy-in. And then HR professionals, you need to stay educated and up to date on the ever-changing landscape of our organizations and the laws and how we can, and the best practices for addressing those and implementing employee supports. So now I want to thank you for joining me on this presentation. We acknowledge the importance of collective effort and collaboration in addressing mental health challenges and fostering a supportive work environment. Hopefully, you have taken away some tools, resources, and tangible steps to evaluate where your organization is and what improvements you can initiate while fostering mental health in your own workplace. If you would like to connect with me, my LinkedIn and my email are on the screen. And now I pass the baton to you to take it from here. So we are just about 5 minutes, Marissa. I'm not sure if there is anything in the Q&A.
Sure, there's one question in the Q&A, but right before we get into that, I just have a few things I'm going to post in the chat where you can find this webinar later today. You can find it on YouTube and it will later be on our website. The website might take a little longer just because we're in between. Anyway, YouTube is where you can find it later today. And then I'm also going to post the slides as well. So please hold for that.
Yes. And Kimberly, I do like your question or comment. It is true. There have been a lot of organizations since we are at this era of post-pandemic where they are requiring employees to return to the office. And I think where HR can be a resource in this avenue is really ensuring that there is equitable review parameters for how to evaluate what flexible work arrangements you as an organization can offer. And maybe this is also where you're going to be advocating and looking at the productivity and some of the metrics that you have from the pandemic era. Really pull that in to help your leadership understand that, is it people's, in the seats that is going to get things done, or is it giving them the flexibility that is going to have our employees at their best and giving their best? Because when employees feel valued, their productivity and their performance goes up, and that's going to pass on to your clients and your constituents. So yeah, I think HR needs to do a lot of work in this arena to make sure that we're not just making policies just to have them, and that they are rooted in some tangible metrics. So again, thank you for joining us.
And thank you, Megan, for the insightful information. I'm sure we all learned a lot today. At CPS HR Consulting, we're committed to partnering with government and nonprofit organizations. Our suite of services and products range from DEI, employee engagement, recruitment, training, test rental, classification and compensation, and so much more. If you're looking to transform your organization, contact us today to see how we can tailor our services to meet your unique needs. Lastly, we invite you to share feedback on today's session. Please take a moment to complete our short survey that will appear after the webinar closes. Your thoughts help us improve future webinars and tailor content to your needs. Thank you in advance for your time and insights. Once again, thank you, Megan, and thank you to everyone who joined us today. Our next webinar is scheduled for June 26th, and the topic is developing an executive recruitment strategy that attracts the right candidates, and we hope to see you there. So thank you for being here. Thank you, Megan, and everyone have a great rest of your Wednesday.